On behalf of the Estates and Facilities Division at Mid-Cheshire Hospital's NHS Foundation Trust, we would like to welcome you. The Trust is based on 2 hospital sites and an intermediate care property. The main site is Leighton, a 550-bed acute hospital in Crewe. The other site is Victoria Infirmary in Northwich, and it also runs a 30-bedded intermediate care facility called Elmhurst in Winsford. The Trust treats, on average, 380,000 patients annually and employs over 3,200 staff. We, at the Estates and Facilities Division through contractors like you and our own staff, must maintain, refurbish and construct in line with the Trust's high standards. Whilst undertaking works, the Trust expects contractors to aim for 0 accidents, 0 injuries or ill health to those working on or coming into close contact with the works, 0 complaints from Trust staff, patients or visitors. We also expect the work to be undertaken in a professional, courteous and conscientious manner with minimal disruption to the hospital environment and in line with all statutory acts and regulations including health and safety requirements. This induction has been produced to give you, as a contractor working on the Trust premises, an understanding of the unique nature of working in a hospital environment. The hospital has unique issues and risks connected with its activities. By the nature of the work undertaken in a hospital, there will be a high number of frail, sick, or mobility-impaired patients. In addition, there are visitors and staff who are not used to construction-related works. Work, therefore, needs thought, planning, and high standards of housekeeping, and enclosure to protect patients, visitors, and staff. Remember that for some very frail patients, even a minor incident could result in the possibility of severe injuries or worse occurring. The Trust operates a strict no-smoking policy, and smoking is not permitted on site. Mobile phones can interfere with sensitive medical equipment and hence can only be used in non-clinical areas. The key contact for your works will be the person from within the Estates and Facilities Division who has arranged for the work to be undertaken. We call the key contact the Trust's host. For maintenance, repairs and minor alterations, including mechanical and electrical, this will generally be the workload coordinator. For project or scheme works, this will generally be the project manager. The Trust's host is the initial point of contact for any issues that may have an effect on any hospital activities or third parties. Such items include deliveries, storage of materials and waste removal, access to adjacent live hospital areas, access to restricted areas, including roofs, plant rooms, ducts, and confined spaces, isolation of mechanical, electrical, medical gases, and other specialist services, fire-related matters, including detection and fire protection measures. All contractors shall be under the control of a permit-to-work system. In addition, for small maintenance repairs and minor alterations where the works are too small to be run as a project, the Trust's host will also be responsible for ensuring that adequate job-specific health and safety information has been produced for the proposed works, and ensuring that access is given to the Trust's Asbestos register to check on survey findings for areas of proposed works. To ensure safety of patients, visitors, and the Trust's staff, and for the effective monitoring of contractors working within the Trust sites, all contractors, subcontractors, and authorised visitors, including supervisors and management, must have and wear or display a valid contractor pass before commencing work on trust premises. Contractor passes are issued at the reception office of the Estates and Facilities Division. Contractor passes are issued on either a daily, multi-day or weekly basis. The contractor pass contains the following information: the contractor's name, the contractor's photo and signature, the company the contractor works for, who the trust's host is for the works, type of work that the contractor is undertaking, and when the contractor pass is valid until. Pre-arrangement of visits outside of normal working hours shall be by prior arrangement and agreement. Contractors are required to scan themselves out at the end of their shift each day at the Estates and Facilities reception. Contractor passes must be returned to the Estates and Facilities reception upon completion of works on site, or when renewing a pass for a further period of time.
Are you back again tomorrow? Or
No.
That's it.
Failure to wear a valid contractor pass may result in removal of the person from trust premises. Keys needed to access some locked areas within the hospital, such as plant rooms, can be requested and booked out at the Estates and Facilities reception. All keys must be returned to the Estates office at the end of each day, or out of office hours dropped into the letterbox. Keys must not be removed from the hospital. Cost for the replacement of lost keys, and in some cases the replacement of locks in sensitive areas, will be paid by the contractor who has lost the key. To ensure that proper planning and consideration is given to suitable safeguards for areas of potential risk, or where works could have a serious impact on live areas of the hospital, the Trust operates a permit-to-work system and process for isolations. The Trust's host will advise if permits are required for the proposed work. Typical permits and isolations include any works to or affecting medical gas pipeline systems, electrical high and low voltage isolations in live areas, work within confined spaces, hot works, works to roofs, including access onto restricted areas, water and steam systems, ventilation systems, fire alarm systems, radiation areas, local exhaust ventilation from laboratories, etc. The pathology laboratory operate their own separate permit-to-work system. Permits may also be required for work in areas with limitation of access restrictions in place. Typically, these are access to high-voltage compounds and substations, access areas known or believed to contain asbestos. The isolation of life services, ventilation and fire alarms normally have an effect on other users within the surrounding hospital environment, so alternative provisions and arrangements are required. Because of this, 1 working week's notice is required where isolations are part of planned works. Unforeseen or emergency isolations and permits will be accommodated as promptly as possible. Despite a large amount of asbestos removal work having been undertaken throughout the Trust, there are still asbestos-containing materials within hospital buildings. It is very important that you make sure that you have looked at the Trust's asbestos records for the area you propose to work in before starting work. For larger projects, an asbestos survey covering the work area will be held by the project's principal contractor. A red-lined plan showing the extent of the asbestos survey will be displayed at the site entrance. For smaller works, the Trust's host should be asked for the asbestos records for the work area. If you discover what you think may be asbestos, stop work immediately and report it to the Trust host. The risks and effect of the health of patients having to evacuate from fire within a hospital is far more severe than in any other building or workplace. Total evacuation from a hospital building is always a very last resort, with high levels of fire detection used to give early warning and physical barriers to restrict the spread of fire. This is what the Trust's fire alarm sounds like, and if you hear this, you should immediately safely stop work, leave the area, and assemble at the designated fire assembly point. In addition, you may hear an intermittent alarm, and this means that there may be a fire in an adjacent fire compartment to the one that you are working in. In this instance, you should prepare to evacuate the area should the intermittent alarm change to a continuous tone. Where construction work may create false alarms through dust, smoke or fumes, the fire detection within the construction area may need to be altered from a smoke detector to a heat detector. For project or scheme works, contractors must check the daily fire alarm isolation sheet applicable to the area of work before the commencement of any works. Specific detectors may need to be isolated and protective caps fitted during the day, with the caps removed and the system made live outside of the project's working hours. However, the protection fitted must be by caps and not latex gloves. Any alteration or isolation of a live fire alarm system will require a permit to work from the Estates and Facilities Division to be completed in advance of the required programmed isolation or alteration works. Many internal walls within the hospital are designed as fire compartments to limit the spread of fire. Following enforcement notices from Cheshire Fire Authority, the Trust has spent millions of pounds ensuring the continuity of fire compartment lines. Where possible, you should use the existing easy path to pass cables through fire compartment walls. Where work involves making holes for pipes and cables through walls, typically above the suspended ceiling level, you could stop the fire compartment doing its job if a fire occurred. You should, at the end of each day, ensure that the holes are filled with rock wool as a temporary measure to make sure the fire compartment prevents the spread of fire. At the end of the job proper, fire retardant measures should be put in place, such as intumescent filler panels or sealant. The work needs to be photographed and signed off by the Trust's host. If you are unsure the wall you are working on is part of a fire compartment, then ask the Trust's host for the works. Bottled gases typically used for heating and cutting are generally highly flammable. Oxyacetylene, as well as being highly flammable, is also volatile and unstable. If oxyacetylene cylinders are left within an area where a fire starts, they are extremely dangerous, and this situation would lead to total evacuation of a large area, typically over 200 meters. This would take place for an extended period of time whilst the cylinder is cooled with water and stabilized. No oxyacetylene cylinders are to be stored on the premises overnight. Due to their hazardous nature, use of highly flammable bottled gas in the hospital should, wherever possible, be avoided. Approval must be given by the Trust's host and a specific permit to work completed prior to use of bottled gases on site. Where approval is given, the smallest sized cylinders possible must be used and housed in a purpose-made trolley, which can be removed off-site easily at the end of each day and taken outside if a fire alarm is activated. When construction work has to be undertaken within occupied areas of the hospital, it is vital for the safety of patients, staff, visitors, and yourselves that the work area is suitably protected to prevent injuries occurring. Warning signage and barriers should be in place when working within live areas such as corridors. For some short-duration works involving frequent changes of location, work around corners, etc., The use of another worker as a lookout could be more suitable. What is certain is that choosing to do nothing to warn and protect others is not an option. Care should be taken when using tools around live areas. Extra measures should be taken to prevent injuries if tools are operated in areas in use by patients, staff, and visitors. Suitable warning signage and barriers are still required in areas with staff only. Remember, many of our staff are not familiar with construction works and the risks associated with these works. Tools and materials should not be left unattended unless secured. Always respect patients' privacy and dignity when working in live hospital wards, clinics, or consulting rooms. Check with nursing staff before entering areas closed off by curtains. Always look for the privacy and dignity signs displayed outside of curtained-off areas.
Can you just make sure nobody's in there?
Always check with nursing staff before entering a room. This includes side rooms, shower, bath, and toilet areas.
Thank you.
Infection control is a very important element within the hospital. We are all aware of how poorly we feel when we get a sickness and diarrhea bug. For patients who are already weak, or those who are reliant on life support machinery, or who must remain in a sterile environment, contracting such a bug could prove life-threatening. MRSA, C. difficile, and norovirus are all commonly publicised in the press in connection with hospitals, but simple measures can considerably reduce the risks. Firstly, always use the alcohol gel, which are located very visibly in the entrance to all wards. Follow the guidance photos to use it properly. Secondly, always wash your hands before eating or drinking and after using the toilet. Never use a bed, bedside cabinet, or overbed table for storing tools or materials. Never climb on a bed when doing overhead works, and never use patients' cups or plates. Dust can also cause risks to patients. Risks can be reduced by regularly tidying up work areas and always moving waste in lidded wheelie-type bins with a clean exterior or in sealed bags. Working in a clinical area when you may be unwell yourself puts patients, colleagues, and hospital staff at risk. Do not attend work if you have any kind of suspected or confirmed infection, nausea and/or vomiting, or diarrhea, a bad cold or chest infection, prolonged sore throat, or any kind of undiagnosed skin rash which may be infectious. Additionally, all open wounds must be covered with a waterproof dressing and assessed to make sure you do not present a risk to others, and to ensure you are protected from any potential infections that might affect you. Legionella is bacteria commonly found in water pipework, which has been left unused for a period of time. The bacteria are in aerosol water droplets created when the uncirculated water is run, and if inhaled, can lead to an infection of the lungs called Legionnaire's disease. This disease is often fatal. The risk of this bacteria buildup can be minimised by undertaking and recording a flushing regime. The process will be explained to you if it is needed on your project, but involves running each tap or other water outlet within the project area, normally for 5 minutes twice a week. As part of the work within the hospital, some processes use or create radioactive sources. The Trust's host responsible for your work will advise if there are any radiation risks in the area of your work. Any work in such areas will only happen when receiving suitable guidance from one of the Trust's radiation protection advisors. However, generally take notice of all warning signage in place throughout the hospital. Medical gases of many different types can be found around the hospital. Some can be found fitted in trunking above hospital beds. Some are found in standalone bottles, and some, known as VIEs, can be found in very large white cylinders housed outside. Most medical gases are pressurized. Whatever form the medical gases are in, none should be touched by contractors, except for those working for specialist medical gas companies appointed by the Trust. Always adhere to warning signage in place. Whilst it is obvious that a lot of construction work cannot be carried out without creating some noise, we would ask that you remember that you are working in a hospital. Please consider areas close to your works, including the areas above and below. Minimize the amount of noisy works, and where possible, if you have to carry out noisy works, then try and alternate it with other quieter work, so that there aren't long continuous periods of noisy works. Many wards have a quiet hour in the middle of the day, during which no noisy works are allowed. The Trust's host for your works should advise you of any ward quiet hours that you need to stick to. Unless you have received permission from the Trust's host for the work you are on, you must not put waste and rubbish from your works into the Trust's skips or waste bins. Usually, your company will provide, or there will be a secure enclosed skip provided, especially for the project you're working on. Always close the skip after you have emptied waste into it to stop any waste blowing around the hospital grounds. Never put rubbish or waste into the Trust's wheeled waste bins. These bins are colour-coded for specific hospital waste and are not for builders' waste. When moving waste within the hospital, it must be in lidded wheelie-type bins with a clean exterior or in sealed bags. A first aid kit must be available for use by contractors. This must not be the Trust's own first aid equipment or supplies. You should be aware of the location of the first aid kit. There should be at least one trained first aider on all works. You should know who the first aider for the works is. There is a minor injuries unit at Victoria Infirmary Hospital which will deal with injuries such as cuts, grazes, sprains, or debris in an eye. For more serious injuries such as heavy bleeding, deep wounds, broken bones, etc., there is an emergency department, sometimes referred to as an A&E department at Leighton Hospital. If an ambulance is required, dial 999 on any internal hospital telephone, which will put you through to the emergency operator. Use of the emergency department for routine first aid is not acceptable. Contractors should only attend the emergency department if the injuries are beyond the training of the first aider on site.
What time is the injury?
Ensure that all accidents, however minor, are reported and an incident form completed. The compliance manager for the Estates and Facilities Division through the Trust's host for your works must be promptly notified of any serious or untoward incidents. There is no free parking available for contractors' vehicles within the hospital. Contractors must use the pay-a-foot system for parking within Leighton or the pay and display at Victoria Infirmary. A valid ticket must be paid for and displayed on all vehicles at Victoria Infirmary. Deliveries to a project or collection of waste should be undertaken outside of the busy periods around the hospital. Advice on the best time for deliveries can be gained from talking to the Trust's host for your works. All deliveries or collections must ensure that the access roads within the hospital grounds are kept clear at all times to allow the free flow of vehicles. Larger projects will also have a small area allocated which will form a compound. The compound typically contains an enclosed skip and sometimes either a site office or container. The compound must be enclosed with Harris-type fencing. and be securely locked when left unattended. Due to very restricted space within the hospital's grounds, only large projects have space allocated for standalone toilets and canteen facilities. The hospital is happy for you to use visitors' toilets. However, you must respect the facilities and do not wear dirty boots or heavily soiled clothes within these public areas. Under no circumstances are contractors allowed to use patients' toilets. Contractors are allowed to purchase food and drinks from the dining rooms for taking their breaks, provided that soiled clothing and dirty boots are changed prior to using the facilities. Under no circumstances are contractors to use departmental or ward restrooms or day rooms. Whether this is your first time at the Trust or you have worked here many times in the past, we hope this induction to the specific issues around the Trust sites and intermediate care property has given you an understanding of why certain rules and procedures are in place. Please remember the goals for contractors which we highlighted at the start of this induction. If you have any further questions, please contact the Trust's host for the project you are to work on.